And now I will request Rakesh sir to take us further on these topics. The sir will focus on career prospects and university offering the course in this field. So as you can see on the slide also, the health psychology, education and career. So I think you will get all the answers that you are required to be a psychologist or clinical psychologist, sorry, health psychologist. So, sir, now you can take over the session and you can continue with this session so that they can benefit for the same.
Good morning, respected Anand sir, President, Indian Academy of Health Psychology, Atulji, and dear participants. I'm going to share you what are the options in education and career in health psychology. Let us first differentiate between mental health and physical health. Mental health deals with mental health conditions, both mental health and illness, psychological disorders, also called mental and behavioral disorders, listed in International Classification of Diseases, ICD-10, DSM. The disorders like schizophrenia, mania, depression, anxiety, phobia, obsessive-compulsive disorders, hysteria. These are the disorders which are grouped in mental health disorders they deal with. And the physical health relates to the body conditions, any chronic acute physical health condition, for example, diabetes, arthritis, thyroidism, hypertension, asthma, persistent headache, pain, etc. There's a long list of physical health conditions. So we are contrasting here between a clinical psychologist and a health psychologist. Clinical psychologist primarily is trained in understanding, assessing, diagnosing, treating mental health conditions primarily. It is not exclusive, but primarily. So a clinical psychologist will deal with mental health conditions, and a health psychologist is trained to deal with physical health conditions, general medical conditions, the disorders of body. Here, we must also understand that psychological factors, stress, emotional disturbances, either cause or add to the onset of physical disorders or continuation of physical disorders. This is one point. Second point is health conditions. For example, hypertension, cardiac disorders, liver disorders, respiratory disorders, skin disorders, they do have psychological implications. Once a physical disorder develops, it can cause anxiety and depression. So the domain of health psychology is quite broad. As a health psychologist deals both the causal etiological factors or contributing factors in health conditions as well as psychological emotional outcomes of health conditions. Sir has cited an example that there are some cases of serious medical conditions, for example, cancer, HIV, and even COVID, we are seeing that people tend to commit suicide. So health psychologist has to take care of both the physical conditions as well as negative emotional outcomes of health conditions. It is not that health psychologist deals with disorders, bodily disorders, medical conditions, but It is health, the role of health psychologist is there both in illness and wellness, maintenance of health, promotion of health, prevention of medical conditions, bodily disorders, as well as when disorder develops, the treating health conditions through psychological means along with medical treatment, and also rehabilitation of chronic incurable medical conditions like diabetes, cancer, HIV. So as such, the scope is very wide. Now coming to the courses. First, I would like to highlight that in India, so far, the field of the sub-discipline of clinical psychology, psychology is the discipline and clinical psychology is the sub-discipline. The sub-discipline of clinical psychology and the sub-discipline of rehabilitation psychology, only two sub-disciplines are regulated. Regulated means regulated by Rehabilitation Council of India. Rehabilitation Council of India is a statutory body which is formed through an act of parliament. It has statutory authority to regulate the profession. So only two professions are regulated so far. Please remember, clinical psychology and rehabilitation psychology. So let me first tell you that in clinical psychology, there are three courses. These courses I'm mentioning in university, mostly in university and some in institutes, post-graduation in clinical psychology. You can differentiate MA in psychology, MA in clinical psychology. UGC has a model syllabus for MA in clinical psychology. Some of the universities like Barkatullah University is having MA in clinical psychology. There are postgraduate diploma in clinical psychology being conducted in some colleges and universities and institutes in India. Also PhD in psychology and PhD in clinical psychology. Please contrast. PhD in clinical psychology is conducted by some of the institutes of psychiatry. For example, Central Institute of Psychiatry, RINPAS, AIMS, PGI Chandigarh. There are some institutes which award with PhD in clinical psychology. So now coming to the regulated. When I'm saying regulated means only regulated professionals, those who are registered under RCI, Rehabilitation Council of India, they are allowed to practice the profession of clinical psychology. That means they can only diagnose and treat patients with mental disorders, no other psychologists. Because other psychologists are not recognized, not regulated. So RCI has three programs, regulated programs: professional diploma in clinical psychology, 1-year course being conducted in Amity University at Noida, MST, Gurugram. MPhil in clinical psychology, there is a long list of about 40 institutions. Then PhD in clinical psychology, Amity University in Noida and Swikar. Why I'm telling you about that? By understanding how the discipline is progressing with respect to profession, with respect to regulation, then the similar standard we have to follow in case of health psychology. Courses in health psychology. There is only one university in India which is having nomenclature of health psychology courses. That is Central University of Hyderabad. There is a Center of Health Psychology. The Center of Health Psychology conducts two programs in health psychology. First is 5 years integrated MSc in health psychology. Health psychology you can pursue after +2, after +3, after post-graduation. 5 years program one can pursue after +2 with intermediate art or science. That there is an entrance examination in about 38 places across the country conducted by Central University of Hyderabad. So you can have 5 years, you can enroll in 5 years course. And if there is an exit option, if someone wants to exit after 3 years, then that person will be awarded BSc degree, and upon completion of 5 years, that will be MSc in health psychology. It is not MA in health psychology, but it is MSc in health psychology. Then there is direct after +3 graduation, one can enroll in 2 years MSc in health psychology. The entry qualification is BA psychology and BSc. Commerce qualification is not eligible, and there one has to qualify the entrance examination, which is objective type questions or MCQ type examinations. The application advertisements is released in the month of February and March every year. One can keep a track of the website of University and Center of Health Psychology in Hyderabad. Then there are other courses in psychology other than this exclusive course on health psychology. Some universities are having optional papers like MD University Rohtak, Gurukul Kangri University, and there are some other universities which are having optional papers specialization in health psychology. MD University is having a special assistance program in the area of health psychology. It is a quite advanced department of health psychology. Then Ph.D. in psychology with a topic on health psychology. One can pursue this Ph.D. in psychology in Center of Health Psychology and comfortably take a topic on health psychology. Also, there are in any university, wherever you are enrolled in psychology, you can take a topic on health psychology, maybe diabetes, respiratory disorder, skin disorders. Anand sir has already supervised several PhD theses on the topics of health psychology. There are in Christ University, Bangalore, there is a 6 certificate course on health psychology, and which is a course of university. And there's a diploma course run by some private institution in Coimbatore, diploma in health psychology. Please remember one thing. As a student, last year, a student contacted me to continue a course in clinical psychology after post-graduation. Then she completed her post-graduation from some institute in Delhi, Institute of Psychology or something, and that course was it was a fake degree. So you must always be aware of fake courses, fake degrees, fake certificates, because psychology has attracted lots of persons from various streams, and you must be alert and aware. So any program you want to pursue, you must consult your teachers, supervisors, mentors, whether it's a proper course, and you must examine it from the university's website, whether the institute is listed in fake institutions and fake degrees. It is very important because, see, that candidate didn't know it was a fake degree. When I pointed out, and before me, she contacted her authorities in that institution after completion of the course, and specifically when I inquired specifically whether it is a legitimate course or a fake course, they evaded the response, they misguided her. So she had to enroll once again in post-graduation program and continue. So what I'm going to impress, that at this point of time, we do not have health psychology as a regulated profession, but there is a Allied Healthcare Profession Bill 2018, which is coming up, and that bill is likely to include counselors, behavioral health psychologists. There are many categories. When that bill is passed, it becomes an act and it is implemented, and the courses are recognized, which will be recognized by that council established under that act, will be valid courses. Then the discipline of health psychology will become regulated. One more thing, No MA degree is a professional degree. MA in psychology is an academic degree. Solely on the basis of MA, one cannot practice. So either it has to be a professional degree, an applied degree, then only one can become eligible. Like in case of clinical psychology, it is post-MA specialization after PG. One has to do either 1 year diploma, 2 years MPhil. MPhil nomenclature is going to change now. Then MPhil in clinical psychology or PsyD in clinical psychology. So the specialization of health psychology after MA is not yet present in our country. So what can you do? The best combination what I am contemplating since yesterday is that if those who are truly interested in the area of health psychology, they must go for a course in Central University of Hyderabad, the PG course in health psychology. So that will be a PG degree. And after PG degree, enroll oneself in MPhil in clinical psychology or whatever the new nomenclature will be, the regulated profession of clinical psychology. Then you will be equipped both dealing with physical disorders as well as mental health disorders. So you will become a valid professional who will be allowed to practice the profession of clinical psychology. As on date, MPhil in clinical psychology is having one paper of behavioral medicine in part 2, second year. And that behavioral medicine component is the management of physical disorders through psychological methods. So as on date, the clinical psychologists are working in medical setup. Those who have completed their MPhil in clinical psychology, they are working in medical institutions, medical hospitals. So they are contributing immensely, significantly for renal diseases, reproductive medicines, then organ transplantation. There are many areas that people are dealing with. When the subdiscipline of health psychology grows further, and we have equivalent program. First, there was a program in clinical psychology, then rehabilitation psychology program came later. Clinical psychology programs are being conducted since 1960s, and rehabilitation psychology, MPhil rehabilitation psychology is of a recent origin. Similarly, we are having a vision of MPhil equivalent course in health psychology. This is our vision, MPhil in health psychology. And again, if this Allied Healthcare Council becomes a reality, and then regulation of that course by that council, so you become a proper professional in psychology. So there are conditions, so I'm skipping because of time. Sir has already explained that role of biological, psychological, environmental, social factors in causation maintenance of physical disorders. Then functions of a health psychologist. So please, there was one question whether a psychologist can be allowed to practice therapy. Yes, proper, if there is a proper regulation, properly trained. Or solely on the basis of postgraduate qualification, MA is an academic degree. So one has to have additional training, practical training, and authorization. Very soon you will learn that what harm can be caused to you, to the society, if one is engaged in unregulated practice. So our aim as a psychologist is to be to maintain high ethics, practice ethically, practice in those areas in which we are competent, we are authorized to do. So that is very important. One more thing is there are many courses, both MSc courses, diploma level courses, PsyD is a degree, PsyD level courses, Ph.D. level courses in abroad. The British Psychological Society, American Psychological Association, Australia Psychological Association, Australian Psychological Association. There are many countries offering good programs in health psychology. But by completion of their programs in America, in Britain, and elsewhere in any developed country, one does not become automatically eligible to practice psychology in our country. That has to be remembered. That our country, the regulatory authority of our country must grant concurrence, approval, equivalence to the training program of other country. So automatically one does not become eligible. Since this is an upcoming field in our country, we are still on the path of development. So whenever there will be a council, the council will make equivalence of foreign qualifications, because a person trained in our qualification, in Indian qualification, for example, MPhil in clinical psychology does not automatically become authorized to practice clinical psychology in those developed countries. One cannot practice clinical psychology in America, Britain, Australia by virtue of RCI qualification unless there is a mutual agreement between two regulatory authorities, a regulatory authority of our country, regulatory authority of that country. So unless there is a mutual agreement, so one cannot automatically become eligible. So whenever you want to pursue a course, be it a clinical psychology, be it a health psychology or any psychology, you must clarify that you will become eligible to practice in this country if you want to return to this country to practice. So this is an issue. So health psychologist will be required to assess psychological factors, emotional factors, stress, make a diagnosis, psychological diagnosis. So the psychological diagnosis will be different from medical diagnosis. For example, diagnosis is diabetes, and the psychological diagnosis will be stress. What kind of stress? Family stress, job stress. What kind of stress? So diagnosis of psychological factors, assessment of psychological factors, then remediation of psychological factors through psychological procedures, psychotherapies, cognitive behavior therapy, and any other therapy, family therapy, hypnotherapy, whatever, biofeedback. There is a range of therapeutic options in health psychology. A health psychologist will be involved in research, conducting research, evaluation of psychological factors in physical disorders, prediction of outcome of physical disorders, then evaluation of role of medicines, evaluation of role of psychological treatment in physical conditions. That these are the points of research. Both teaching and training of health psychologists, liaison in multidisciplinary team, collaborating with medical professionals, social works, nurses in the overall management of patients of physical disorders, prevention of physical disorders, prevention of psychological factors, and rehabilitation. 2 गज की दूरी, मास्क लगाओ और मास्क लगा के रहो, सैनिटाइज करो, 2 गज की दूरी रखो, ये क्या अटेम्प्ट है, कोविड के प्रिवेंशन के अटेम्प्ट हैं, ये हेल्थ बिहेवियर्स हैं. सो इस तरह के जितने भी बिहेवियर्स हैं, आप मेंटेनेंस ऑफ हेल्थ स्टाइल, डेली एक्सरसाइज, maintaining health, these are preventive attempts. These are then community awareness and interventions regarding health problems, promotion of health and well-being, policy recommendations at the level of government and other bodies. So the health psychologist will have many functions to perform. Career. So far, more clinical psychologists and health psychologists trained by Center of Health Psychology are working in the setup of health psychology. Also, there are some postgraduate students, those who are appointed as HIV counselor. So they are also, in a way, they are also working in health setup. So after PG also you have some scope as a counselor, and Allied Healthcare Professional Bill is going to recognize MA as a qualification for counselors, so behavioral health counselors. So even after PG, you can have a PG or you can have a PG in health psychology. If you have a PG in health psychology, you can better deal with those physical conditions, you can better counsel those persons. So medical institutions, hospitals, even like clinical psychologists, when there is proper program of health psychology, the health psychologists will have their own clinic, their own health setup, their own institutions. One of our senior, he is having an institute, a center of psychosexual medicines, and is doing wonders in the South India. So that sexual medicine is a area of psychology. So one can have a center, full-fledged center of one's own. Then involvement in research and training is there. This regulation I already explained. And there is there are two associations of health psychology in our country. One is Association of Health Psychologists, formed in 2015 at Center of Health Psychology. This is the website. You can browse that website. And this association is publishing a Journal of Health Studies, which was launched in 2019. The journal has its own website. The seat of this association is Center of Health Psychology. And we are part of, Anand sir is president of Indian Academy of Health Psychology. He has taken lots of pain, doing lots of things, lots of contribution. He formed the Indian Academy of Health Psychology in North India. It's a national level association. There are a good number of life members and very many programs conducting annual international conferences, collaborating globally, internationally to conduct programs of health psychology, conducting workshops on the topics of health psychology. And then we are in the process of launching more programs, short-term programs, certificate programs, or skill training programs, workshops. And E-Academy of Health Psychology was established in April 2020. We are conducting webinars and will be involved shortly in all these short-term activities, literature development, and all. And we are also envisaging a journal of IHP, Journal of Health Psychology, Clinical and Health Psychology. It will be coming soon, and short-term programming we are going to launch. One more point is there, our vision in education. In education, my vision is that health psychology, we are splitting into a sort of theoretical and research health psychology involved in teaching and conducting research, and clinical health psychology. The clinical health psychology profession will be dealing directly with the patients, handling the patients, be it organ transplantation, be it suicide, be it diabetes, respiratory disorders, asthma, skin disorders, then cardiac disorders, disorders of reproductive system. So our vision is that we should have proper education program, not less than the training program of clinical psychology, rehabilitation psychology. It should be equivalent program so that we have an equivalent status in our country. Psychology is the discipline. So one is clinical psychology, second is rehabilitation psychology, and health psychology in making. So we have the program of clinical health psychology we are contemplating, and the career options. This is just a vision, not yet a reality, but a vision that every medical institutions, every hospital, every CSC, PSC should have a health psychologist. And even health, there are different specializations in health psychology. A health psychologist is specializing in renal diseases, in cardiac diseases, in respiratory diseases. So each department in the long run can have a health psychologist. It's a long-term vision, and let us wish that our vision comes true someday. And we are open to your questions. Thank you very much. Thank you.
Thank you very much, sir, for this detailed description and detailed information about education and career in psychology and what will going to happen in next few years, all those things. So that is very enlightening and crisp and clear information for these participants. So I request if you have any question for Anand sir or Rakesh sir, you can ask.
Yes, we are seeing there are many questions.
Yes, sir.
सर
Yes, sir. Could I
सर
read them?
आनंद सर आप देखिए आप कौन कौन से क्वेश्चन आंसर करेंगे, देन आई
आप देख लो, कोई दिक्कत नहीं है, नो प्रॉब्लम।
Sir, can I read and
मैं करता हूँ, मैं पढ़ लूंगा, नो प्रॉब्लम,
आप देख,
मैं पढ़ लूंगा,
आप देख,
मैं पढ़, just 1 minute, I'm answering each and every question. Being a psychology student, sometimes it becomes difficult to choose a particular subfield for the master's degree, as all fields appear fascinating. How to overcome this confusion? Psychology is a very good subject. हम बोलते हैं जहाँ मन है वहाँ मनोविज्ञान है. So मनोविज्ञान का study करना it's really fascinating. You study any branch of psychology, as I told, right now the first option is clinical psychology, then rehabilitation psychology. If you want to have an applied career, a professional career, and if you want to have a career in teaching and research, you can opt any kind of any sub-discipline, even cognitive psychology, in organizational behavior. There are many good branches of psychology, but if you want to treat the patients, so you have an option of clinical psychology, rehabilitation psychology, health psychology once it is approved. So you plan your career, what you want to become in future. You have to assess yourself, your aptitude, and choose accordingly. So health psychology comes under clinical or counseling psychology. Like psychology is the discipline, then clinical psychology is a sub-discipline, counseling psychology is a sub-discipline, health psychology is a sub-discipline. These are of equivalent status, not less, not more. Equivalent status. So clinical and counseling psychology seem to overlap. Clinical psychology deals with disorders with therapies, counseling psychology with counseling, mostly non-pathological conditions. You can understand in a simple manner. Our nation need an national psychology university. New education policy is discouraging distinct or specialized universities like health university or technical university. They are merging every university, all types of courses, all types of stream. So national psychology university may not be a reality in coming years, because each university will be dealing with all aspects: medical, technical, arts, commerce, engineering, everything. So that separate thing will not be required in coming years in the light of new education policy. Website already written. So if you want that our PowerPoint, we can share our PowerPoint also. You are an MBBS doctor, want to options, and you don't want to become a psychiatrist, you want to become a psychologist, very good. So after but the thing is that you must, especially you must first complete your PG in psychology, health psychology. Barkatullah University, I'm seeing Ayurvedic graduates, BAMS, and then BHMS, homeopathic graduates, they pursue their degree in clinical psychology. So similarly, if you have that passion, you have that time, and then you can invest yourself. I will recommend you to go opt for health psychology program in Central Health University, Hyderabad. Then you can complete your clinical psychology specialization, regulated profession, or health psychology if it becomes a reality. We wish that it becomes a reality soon. Then you'll do wonders in the field of psychology if after your MBBS you are able to do it. Online mode courses, please. Online courses, you can have those online courses in health psychology. There are some countries abroad, there are some courses, but please be aware these online courses are unlikely to authorize you to practice the profession. Just for the sake of knowledge, you can enroll yourself, but go for proper courses, because psychology, there is a chaos in terms of regulation. There are lots of misinformation, misguidance. So be very clear. If you want to deal with patient, you must have an RCI program, RCI approved program, and RCI registration as on date. If you are dealing with patients, I'm calling with patients specifically, and patient of a physical disorder or a mental disorder, whatever the patient, you must have that regulation. What is the basic degree of health psychology? Basic degree of health psychology is that minimum degree is MSc, MA or MSc in health psychology. So after that, there must be a specialization which is lacking in our country. We are trying to overcome the gap. Can health psychologists perform therapy like clinical psychologists? Yes, why not? Bilkul, pakka karenge. Each psychologist can diagnose, treat in one's own area of specialization, be it educational psychology, social psychology, organizational behavior, whatever it is. Application of psychological principles is therapy. So when we deal with patient, it is therapy, and application of psychological principles for improvement, for causing improvement, then it may be a counseling, it may be a psychological intervention. You can call anything. But I'm seeing lots of response. Very good. Okay, very good, sir. Sir, so many appreciations for you, sir. Anand, sir. I'm pursuing MA Psychology Clinical in IGNO. According to your lecture, it is valid for no. MA Psychology is not valid, and neither from IGNO nor from any university. After your IGNO qualification of MA Psychology, you must do RCI qualification, either professional diploma, 1 year diploma in clinical psychology, 2 year MPhil clinical psychology, नाम बदल जाएगा इसका, then PsyD 4 years course in clinical psychology, or 2 years MPhil in rehabilitation psychology. You must go for proper courses. Please don't play with your career. आपको अभी समझ में नहीं आएगा बिल्कुल. जो भी कहीं डाउट हो अतुल सर से पूछिए. आप लोग कहीं भी कोई डाउट हो जाए कि हम ये करें या ना करें, ask him, request him. He will respond to you. He will guide you properly. He has got a vast experience in dealing with training issues. I am a yoga therapist. Very good. Health psychology is very interesting. Help me in going ahead. Complete at least PG in health psychology, then specialize in clinical psychology or health psychology if it becomes a reality. I completed MSc in psychology in general. Now I continue my PhD. PhD in health psychology is not available in our country. PhD in health psychology is available abroad. In our country, you can enroll for PhD with a topic in health psychology, but that will not make you eligible to practice the profession of health psychology. That will be a research degree. It will be good for your teaching and career. Distance course, please don't do any distance course. We are discouraging distance courses. No misguidance. अपने को भी दूसरों को भी. What are good colleges to pursue BSc psychology from? Any university you like. BSc psychology you can pursue from any reputed universities. You can ask this alumni of that university how is the course. Hello sir, I am Dr. Isa Sharma. I have done my PhD from Rohilkhand University. Now I am in Andaman Nicobar Island working in Navy Hospital as clinical psychology. My question is, can I join course with you? Let us have some courses. We will be very happy you join us. Stay connected with us through ISP, through Atul sir. Anyhow, you can stay connected because I have no RCI registration. You must do course of RCI, then only you can have RCI registration. So I'm very emphatic, very clear regarding regulated profession of clinical psychology and rehabilitation psychology and RCI because I'm saving you, not I'm misguiding you. I'm very clear. I'm from Nepal. I completed MPhil in health education from Nepal. Can I study in health psychology PhD? Yes, please. As per your regulation in Nepal, you must inquire what are the regulations there. So it's good that so many people are nowadays interested in health psychology topics. So positive psychology has to do so many things with health psychology. Bachelor's degree, can I do PsyD? Bachelor's degree के बाद PsyD, MA के बाद PsyD होता है. PsyD is a post PG degree. Thank you so much, sir. Really, it is very helpful. Thank you, Vaya. Thank you very much. No more questions. If any other questions, please unmute yourself and ask, or you can type. Hand over to Atul, sir.
Okay, sir. Thank you very much, sir, for addressing all the questions. Anand, sir, for giving too much, so much information from history to till date, and Rakesh, sir, for giving specific, clear guidance to the students because many time, as I am working in that thing like training and all, so I get question, and most of the time number of people are interested in short term things like they want कुछ quickly कुछ हो जाएगा. Suppose I am retired, I am in like engineering, I am a MBBS doctor or something. Can I practice psychology, something like that, or only for 6 months, 2 months, 3 months courses? So that you already said that do any course that is regulated and authorized. So I just want to thank you both And I just want like one or two words from you, like on this shortcut thing, because many of students and people coming to psychology, because it is always, we are always like, everyone is welcome in the field of psychology, but with proper qualification and education, anybody can come and practice. So that I want from you, because that will be more meaningful for them and for everyone. So if you want to give one or two line message, if you are coming to psychology, what to expect, what not to expect, and why this proper training is required. Though Rakesh sir has already added many things. Uh, Sir.
Yes, Atul. Am I audible?
Yes, sir. Yes, sir. You are audible.
Okay. So it was really a great session and very much informative about the health psychology. And we came to know about the origin, prospects, and various aspects of health psychology, its models, career prospects, role of health psychologist, and what to do to become a health psychologist. And we also had information about the fake institutions which are providing such type of degrees which are not valid. So first of all, be careful. If you are making a career in psychology, always be aware of these fake institutions or NGOs or organizations which are providing fake diplomas, certificates, and degrees about counseling, about psychology, and many things. I am looking that many of the fake institutions are providing certificates in counseling, diploma in psychology, diploma in rehabilitation psychology, diploma in psychotherapy, certificates in counseling, and they are not recognized to provide such certificates according to regulations. So, before joining any of the professional course after your post graduation, you must be very much aware, you must have proper knowledge, you must explore that which institution is really worth and recognized, and where you could really get a proper training and you can learn proper skills of counseling in the area of health, in the area of medical sciences, in the area of various mental health problems, in the area of health hazards. So if you want to become a health counselor, or you want to become a health psychologist, or you want to become a clinical psychologist, or you want to become social psychologist, school psychologist, any field of psychology, all the fields are important according to your own aptitude, your own interest, and your own capabilities. So first of all, assess your capability, your interest, and your aptitude. Your assessment is very important. Many people come to me and ask, sir, अब मैंने तो एमए कर लिया है, अब इसके बाद क्या करूं? So they are so much confused. उनको यही नहीं पता है कि अब उन्होंने एमए कर लिया तो उनको इसके बाद क्या करना है. First of all, assess yourself, your capabilities, your aptitude, your financial conditions, your infrastructures, and then decide. It is blend of all these things. Then you should decide about a good institution. You should have a knowledge. You go to the websites, you consult the specialists, you should consult the experienced people in the area of psychology. If you have any doubt or you have any question, you may also consult us. I am 24 into 7 open to you anytime. On my WhatsApp number, on my mobile number, on my mail number, you can ask, you can have proper guideline, proper guidance that what course is suitable to you, what you have to do, and what is the prospect of that area. Not only course, but after doing that course, what is the prospect? When can you get a job? Where can you get a proper job? So you are very much free. Don't hesitate. I am again appealing to all the students who are watching this show that if you have any doubts about your career, if you are in PG level or any level and you want to do research work or do some training program or some professional courses, diploma, certificate, or MPhil or any type of courses, and if you are in confusion that which institute is uh, a good institution, which is not a fake institution, which degree will be recognized, then we are ready to help you. So don't hesitate and just contact us, me or Dr. Rakesh Jain ji. We will be definitely helping you. And our you can get our WhatsApp number on my Facebook account. There is my WhatsApp number also, mobile number also, and Dr. Atul also knows very well. He can also help you in selection of these training programs, which is the recognized training center, which is a fake training center. What is the utilization of which training center? He is very much experienced about this. So we are all here to help you, and God bless you. Thank you.
Okay, sir. Thank you very much. Thank you very much, sir. Thank you, Rakesh, sir, and
Thank you, Atulji. Thank you.
Thank you.
everyone who has joined and made this successful this webinar. And this was very informative. I think they don't get that anywhere credit like this kind of information anywhere else, because this is a new field. You will not find any like site or something where you will get all the those things except this like IHP site. So I just like to show you the website and how you can download the certificate of yours, and these sites where you can get the information of. My screen is shared now, I think, and this is the IHP site. Will look like this, that you can go there. I have already posted the address in the comment box. You can go through and get all the details, and there is Rakesh sir's website, that also you can go there and you can see all the books written by him, and anything related to that, you get all the information, you can write to them. This is there, this is the site. I can you can see all these like books and all. So all these things is there, and you can download your certificate from Tuesday, because today is Sunday. From Tuesday you can download the certificate from here. You will see, here you will see this is like this, like you will see the poster of the webinar, and when you will click on see more, there are instructions you will follow and download your certificate from there. So for today, this we are like signing off for today, and we'll come up with such more workshop with the help of sir Rakesh sir and Anand sir, so that you get benefited from these kind of experienced people. Thank you very much, sir Anand sir and Rakesh sir. Thank you very much
Thank you.
for
Thank you.
And Atul,
helping. Yes, sir.
One important information
Yes, sir. Yes,
that
sir.
if anybody wants to contact me, they may
Mhm.
contact me on my WhatsApp number. Please note down my WhatsApp number.
Yes,
That
sure,
is
sir.
94152021.
Sir,
That is
sorry,
94. Yes.
sir, repeat it. I will type it on the comment box. They can see. Nine
Okay.
four
15
one five
202
two zero two
167.
167.
This is my WhatsApp number.
Okay, sir. I
So
typed it.
yeah, if anybody wants any information, they may just contact without any hesitation anytime.
Oh, okay, sir.
Yeah.
Okay, sir. So, thank you very much.
Thank you, Atulji. Thank you very much.
Okay.
Thank you,
Thank
participants. Thank
you.
you, sir. Thank you,
Okay.
Anand
Thanks a
sir.
lot.
Okay,
Yes,
sir.
sir.
We are signing off. Now, thank you, sir. Thank you very much.
And we'll have some other collaborative programs with you, Atul, as we have
Sure, sir.
discussed in the
Yes, sir.
before COVID. We have discussed a lot about the
Right.
other programs, and
Right.
we will have a plan and we will implement it.
Right. Sure, sir.
And
Sure, sir.
because it a bad luck that when we discussed about many programs and
Yes.
we were all stuck in this COVID
Be-
period.
because
So
of COVID. But no worries, sir.
yeah,
We will nothing like
definitely.
जब भी होता है अच्छा होता है. So what
Yes.
maybe that was not the time. Now the time, whenever time will come, we'll do the same.
Definitely, we'll have a good program for the benefit of all the students and colleagues and other professionals in psychology.
Sure,
Yes,
sir. It
yes,
is like it is my honor.
yes, yes.
Okay, sir. Okay, sir. So we'll
Okay,
sign
okay,
off.
okay.
Okay.